I think one of the most unique aspects of our program is that we have both an academic and community side. We're able to play off the strengths of both of those settings to train you to be the family medicine doctor that you really want to be.
The main reason I want to do family medicine is I feel like you can impact the most amount of people. We're really the frontline workers out there. We get to hopefully stop diseases before they even progress or catch them if they're early enough.
We have access to a lot of different specialties and a lot of different procedures. That's one benefit of being in an academic hospital.
They give you a lot more freedom to practice medicine the way that you want. You still, of course, have attendings watching over you, signing on things, but they back off. They let you practice medicine. And it's almost the feeling of being an attending yourself, and I really enjoyed that.
I just knew that I was going to find a group of people who would support me, who would be lifelong friends, who would really be there for me, not just during residency, but outside of my personal life also. And that was super important, especially being away from home. I think that was super important to me to have a family support.
We have a great patient population to learn with. A lot of patients here at the university especially are very vulnerable patient populations, and so a lot of chronic disease management, a lot of acute illness, a lot of social challenges. You get immersed in that, and you get good at taking care of sick patients, which will train you very well for practice. A large part of the training for our residents is out in the community. And so we have the Bellevue Medical Center that we utilize for many rotations, Methodist Children's, we use Jenny Edmondson in Council Bluffs, we have our rural sites, so you get a broad range of experiences in a broad range of settings.
Because I had that opportunity to be at Bellevue and see that community-based style medicine, I'm well prepared to go out into smaller communities and practice. However, I've been trained in this large multi-specialty academic center, so I'm also trained enough to deal with really complex patients at the same time that you might not get at a smaller community-based residency.
So I get to work at the One World Clinic, which is amazing. The staff at the One World Clinic, both the attendings and the nurses, are incredible. The whole operation is a giant federally qualified health center, and it is run just amazingly.
Our residents are amazing, and so we really look for residents that want to be team players. They want to be part of a family. They care about their patients. They want to work hard. They want to have fun, but really they want to work together as a team and improve the lives of their patients and have a good time while they're learning.
Without a doubt, UNMC produces high quality family physicians year in, year out. One of the things with the military is that they really respect our program and our training, and they know that they can send our doctors to anything. We've had doctors in the military go on to work in the ICU. We've had them be regular family practice doctors, sports medicine physicians, FMOB trained. I mean, really, the unique part of our program is that when we graduate from here, they know that they can trust us and that we are ready and competent to do any job they throw at us.
I feel like they've prepared me very well for the future. As I, finish up with residency, I think about everything that I've learned throughout residency and how I can take that with me. And while I'm sure there'll be some nerve-wracking parts of moving on and not having, faculty right next to me, I feel very well prepared and that I'll be able to take the best care of my patients possible.
Our residents graduate and go and practice everywhere. Some will do full scope rural practice with procedures and OB. Others will practice in the community with a clinic practice with maybe some procedures or a little bit of inpatient. Some will be hospitalists or ER docs. Some travel the world and others stay put here in Nebraska. We're really proud of our grads and our program, and we really would like you to come and take a look.